Oh, crikey. Oh.
So welcome everybody, and this is week 2. And we're going to go through 5 remedies tonight because we only got through 3 last time. But before we do, I want to go through a little bit of a difference between acutes. So just let me share my screen, acute and chronic. I'm going to share it with this one. You can all see that?
Yeah.
Okay. And I'm going to do... Okay. Again, they're the remedies we're doing. So we're going to just have a little look at the difference between acute and chronic complaints so that you are aware of what the difference is. Some guidelines to help you do your own home prescribing, and obviously the conditions that can be treated at home and what shouldn't be. And then we're going to go through, we're going to add Chamomilla to that list, Apis, Arsenicum, Bryonia and Rhus tox, and we're going to do some practice cases at the end. So hopefully we'll get through, and if we don't get through them all, well, we'll just extend it to the following, but we will slowly catch up. I will leave room for us to catch up. So we'll see how we go. So acute complaint, they're different. An acute is something that's been going for either immediately or something that's been there for under 2 weeks generally. So anything major, you know, chronic conditions, we all sort of know them, asthma, migraines, arthritis, things that are there all the time, even colds that are always there. That's another one too. Once it starts becoming, you know, you've got a cold every month, then that becomes a chronic condition. Bronchitis, pneumonia, obviously, and cystitis. So these are the different categories for acutes, which you can treat yourself at home. So contagious illnesses, as you know, colds, flus, chickenpox, mechanical injuries, accidents. Backache, if it's a immediate backache, not a long-term problem. RSI can be treated at home, and any other wounds, cuts, you know, grazes, things like that. Even burns, burns can be done at home, treated burns, poisoning, bites, stings, food poisoning. Most of those you can do yourself. And like any of these situations, if you find that after a few doses of the remedy or things aren't improving, then yes, you would take it further and go and seek medical help. But don't be frightened to give it a go in those initial stages, because you'll be amazed at what good you can do. Hangovers, obviously dyspepsia, which is digestion and, you know, burping and almost like a refluxy. So yeah, acutes are self-limiting, as in they only last for a short period of time and they shouldn't go into anything major. So a little bit, if we look at a fever, they exacerbate quickly or slowly, and then they reach a peak and then they come down. Then they come down again. Obviously, cure or death is a bit extreme, but you know, either we're going to help fix it or it's going to get worse and you need extra help. But I feel like, I mean, we've all had kids, we've all, you know, had animals, we've all had things that we need to treat, where we can see where it's going in the right direction or it's going in the wrong direction. So now, and also knowing that the body sometimes is capable of handling these things on its own. and we don't even need to come in with anything. So sometimes we jump too quick and we try and jump in and help the body, and sometimes we actually don't need to. But, you know, because we are a society of you're not allowed to get sick sort of stuff. But it's really helping your body do what it's trying to do to fix itself. But if it needs to clear out something by an acute illness, then you just need to help it along, not try and stop it. So chronic conditions can return again after an acute. So often the acute, the other thing between telling the differences between acute and chronic is you'll find that your chronic illnesses or things that are there all the time suddenly almost aren't there. And the acute, so the symptoms for an acute will be very clear. We're looking for things that are different to your normal state. So, you know, if you're normally a hot person and then suddenly you become cold and chilly, then that's a symptom of the acute process. It's not so we're not looking, and like your thirst, if you're normally got a strong thirst and you're feeling sick and you've got no thirst, we're looking for the aberration or the difference between what your normal state is and what this acute state is. So once the acute is finished, you'll then go back into your chronic, or we say, you know, those chronic symptoms will then show themselves. That's actually a really good time to treat constitutionally or miasmatically, because you'll see really what your core is, because they start to return. So yeah, chronic is, it's just there. It doesn't decline. It just continues to progress and to do its thing. So acute, obviously the aim is to relieve any pain and suffering. So if your body's not handling it and needs help handling it, well, that's when we come in with the remedies. To speed up the process, obviously, and to support it. And what we find is that if you using the remedy seems to reduce the length of recovery by about 50%. So say, you know, it might take you a week to recover, it might only take you 3 or 4 days rather than 7 days. That's what we seem to find. So things that you can do at home is trauma. You can do some emotional traumas, and obviously ones, colds or throats, earaches, flus. There's lots of stuff you can treat. You can do just general headaches, you know, nosebleeds, hangovers, colic, all these things you can do. Insect bites, which we were just chatting about before, Lynn, before you got here. I got bitten by a bee because, of course, you know, law of attraction, we're doing bee stings tonight. Just to see if I could work on it. So anyway, that was my challenge over the week. It was a bit of a beauty one too. So, oops, I have to do this back. So, which brings me to, are there any questions before we go on to the remedies? I'm racing through.
Tania, oh, sorry, go. Oh, Tania, I was going to ask, can this can treat drug overdose?
Chemical drugs?
Oh, I'm talking about mushroom.
Oh, I would. You could give a remedy, and I'd still get it checked out, go to a hospital or something. So it depends on the symptoms again and how severe. If it's just mild, then you could absolutely do it. But severe, there are mushroom remedies, but depending on the symptoms. So it might be presenting as food poisoning, which is the arsenic amalgam remedy. All of these things, in the end, we're always looking at the symptoms. We're never looking at what it is that the cause. We look at the cause, but we don't. That's just part of the picture. We'll come to that towards the end as to how we add that in. But because we'll go through a practice and I'll show you a table of how to set up and work out what to look for. So whilst one, you know, 3 people might have taken the mushrooms, and whilst they've all taken the same thing, they may have 3 completely different responses. So of course we have to work on those responses, because everybody's body is trying to fix itself in a different way. And the whole point of doing the remedy is to help the body do what it's trying to do to help itself. Yeah, that's really what the system is about. It's an individualized system. It's not a one medicine treats all like the standard medications. So, which, you know, then reduces any chance of side effects, because the body's, you know, side effects are just the body doesn't want half of what you're doing. Welcome, Kat. Okay. So before I go into APIS, I'm just going to come back. I'm going to just stop sharing for a second. And I'm going to try and find my other document, because I ended up putting it back in last week's one, because it's really where it should have been. I'm going to share with you the Chamomilla stuff, because Chamomilla was the one we missed out on last week. I'm just about to share this one. No. Okay. Was that, did that answer your question, Esther?
Yes, I think it's, yeah, it's great. Like, yeah, no, like maybe if it's a mild symptoms, it can be treated. And then, like you said, it's a unique, depends on different people.
Yeah. Yeah, and I think it's the thing that we're not really taught. You know, it's like, oh, you've got this, have this drug, and that'll cover all of that. Just a really different way of treating.
I actually like it, Tania, because when I was in Mexico, you know, when they using chemotherapy to treat patients,
Yeah.
they actually going through a chemosensitivity test. They're making specific chemo drugs for each person, even they are diagnosed with same cancer. So, yeah, kind of.
Yeah, well, it's very similar. We do have remedies similar way with the cancers, but yeah. Yeah, because the body does treat things differently. It's a very individual medicine, which makes it hard. See, it's very complicated. You can't just, it makes the sessions longer, it makes it more detailed. You know, it's not necessarily quick and easy, but it can be still, you know, the more you get to know what remedies, there are generally a few remedies that you should always go straight to when you've got these symptoms or these conditions. So you do get to know them.
So Tania, so like when if you're not too sure about a remedy, as I understand it, if you give the one that isn't the most suitable, it doesn't do any harm. It just doesn't do anything. Is that right? And then
Yes.
if there's not, you're not getting any change from the one you've chosen, then and there hasn't been any change to the condition, then you try perhaps the other one that you might have considered.
Yes, that's exactly right. We do up to 3 doses. 3 doses, 3 to 4 doses, to be sure that you're on the right track. And if nothing's happening, then you would switch across to the other one. You've got to give it time as well, because you can't be switching all over the place. The body gets confused.
Yeah.
So, and it look, if it's close, you're not looking for an exact. It's why it's called the law of similars, not the law of exacts. It can be similar, and it's just some are a bit closer than others. So some will have more impact, others will be a bit slower, even if it's not exactly right. But it's helping a little bit. It just may not hit it, you know, get there as quickly.
Mm. Okay.
You can have a negative reaction, but it will be short-lived and it won't last.
Mm.
In acute, it's harder to see. It's easier to see in a chronic, but in acute, you usually just see it doesn't do anything. Occasionally, it may make things worse, like the nausea suddenly gets worse. You're like, that's definitely not the right remedy. So it can happen. It just doesn't happen very often. Okay, so chamomile tea, we all know chamomile tea.
Mm-hmm.
It can be used for coffee, from excess coffee and for teething. Before I go into it, what do we think of when we think of chamomile? What would we use it for?
And calming, sleep, anti-inflammatory.
Yeah. Yes, it is very calming. So these are the complaints we tend to use it in. Diarrhea, surprisingly. Often it can be a greeny colour, usually in kids when they're teething or when the body's going through major change. Earaches, it's very good for ear pain. Insomnia again, surprisingly, but it helps you calm, obviously that calming quality. It's also good in labour pains. So, yeah, it's grown. Oops, I'm just going to. How do I change this? Sorry. It's grown in Europe, one of its main things. You can actually you can create a proving, which is where you go into the symptoms of excess by taking too much chamomile tea, as it turns out. It's one of those ones that's more likely, because in tea form you can drink a lot of it. You can prove it, which means takes you into the remedy space. It gives you the symptoms that you don't want or the symptoms that it can cure. So with chamomilla, interestingly, too much of it actually creates irritability. It does the reverse. It doesn't create calmness. So if this child or person is really sort of irritable and whiny and restless, and they can be quite sensitive and they don't know what they want, like they're hard to please. You know, those kids where you give them something, they chuck it on the floor, and they don't want that, they want something else, but they don't really know what they want. Chamomilla is also wants to be carried or nurtured or sort of cuddled. So, and they've often got the pain can be quite acute or intense. It can be quite high pain as well. Yeah, excess coffee can be a problem. Also, it is quite good for growing pains as well. They're often worse at night. So often this one comes on at about 9 o'clock at night, teething or any illness. If you get an earache, if you get an infection, it seems to come on at 9 o'clock at night. It seems to be its time. And like I say, they want to be carried. They want to be, they just want to be nurtured. There is an irritability. They're never satisfied. And the other thing that can show is that you can have one red cheek, only one red cheek. You don't usually have both. Or it feels hot only on one side. There's a one-sidedness to it.
Especially with teething.
Yeah. Yeah.
Yeah.
It's a good way to distinguish, because belladonna has 2 red cheeks for teething. So it helps you quickly go, oh, I think I'll try this. And the diarrhea is usually, the stool is quite distinct in chamomilla. It's pretty much always green, because of the acidic level changes in the gut. Yeah, and it can be hot as well, smelling like eggs. Earache, I've used it in adult earaches. You can still get earaches.
Yeah.
And it really does. It does help. Insomnia again. Yeah, too much stimulation. It does calm that nervous system as well. It's lovely. Yeah, there's that unbearability, like there's just no patience with them at all, Chamomilla. Okay, so that's the practice cases from last time. I'm just going to stop sharing that. So that's just any questions on Chamomilla. Now, in your book, Lynn, I don't know, you got one of these?
I did have one years ago, I'll have to get another one.
That's all good. That's all good.
Yeah.
I was just going to refer to it if you wanted to. If you have a look in there, menstrual cramps as well as part of it. Yeah, it actually is a very good crampy remedy.
Now, can I ask a question? I know you're running a little bit behind, so but I don't want to slow you down with too many questions. Can I ask a quick question? Yeah. I've got a client who's on immunotherapy for lung cancer, and it gives her like permanent diarrhea. So it's been over a year now. Peter McCallum says she just has to take steroids to slow it down, which then has a huge effect on her mood. Blah blah blah. I won't give you all the detail. But for diarrhea, if I was looking at that just as a symptom, never mind what's causing it, would I be looking at like if chamomile's for diarrhea, or is it only this specific sort of diarrhea that's being described?
Yeah, you have to look at whether it is hot. It doesn't necessarily have to be green, but it might be a funny colour.
Yeah.
Is it hot? Is it difficult to pass? Is she irritable with it? And has she got any stomach cramps with it?
No, I don't think so. She suffers from irritable bowel syndrome. She always has. So this has just made it, 10 times worse. But that's all. I just want.
Chamomilla can be good for irritable bowels. So
is it okay? All right. So maybe
can be. It could be worth looking at. And the other one, which we will also be going through tonight, I think, is Arsenicum album, which is also a diarrhea.
Your sound's gone off again, Tan.
Yeah, we can't understand you.
Your sound's gone off again, love.
Is that better?
Oh, and she's back.
There she is.
It did say. It tells me it's unstable, and then it tells me it after it's happened.
It sounded unstable.
Am I underwater?
We're all a bit unstable.
Yes.
Yeah,
feels like you're underwater.
Yeah.
I think everyone thinks you speak Chinese. I can understand.
If only.
I don't know. I think it was more fish.
So we are going to cover another diarrhea one tonight as well, which Arsenicum album is the other diarrhea one, which because of and the other thing I often keep in mind when you're dealing with chemotherapy and those sort of things, immunosuppressants, there's so many chemicals in those that sometimes we have to come in with some chemical remedies ourselves as chemical remedies, if you know what I mean.
Right. Yeah.
So,
yeah.
We'll check the symptoms of that one,
Thank
see
you.
what you think about that one. So let me just go into.
All right. Yeah.
Back into this one.
It wants you to resume.
It wants me to resume.
It says,
it does too. Oh, look at that. Thank you.
So it'll go back to where you were.
Oh, isn't that clever? There you go. It's trying to help me and I didn't even know it.
Oh, you'll be no good with AI. You won't listen.
I'm already no good. I'm too much of an independent woman. All right, so we're going to come into APIS, good old bee sting remedy. Burning, stinging, better for cold, cool applications, and they don't want heat at all. It's often a right side, or it moves from the right to the left, which is exactly what my swelling did. It went from left to right in the end. But
where'd you get stung? Did you get stung on the face?
Yeah, on my crown.
On your
God, if that
crown.
wasn't trying to tell me something.
Gee
Yeah.
whiz, and it's governing 20.
Yep. And then, so it sort of blew up there and then it came down my face and slowly came across it. Today is good.
Wow.
I'm doing well. It was red, shiny. It wasn't, I think I must have taken a lot of that heat out of it. It was definitely swollen. Like I say, I kept taking the remedy over and over. So the other thing, not only can apis be used in bites and stings, it can also be used in wasp stings as well. Is cystitis, interestingly, because it can have that red,
Burny,
hot,
stingy.
burny, swelling, all of that. So I've even treated a cat. I've treated dogs and cats and humans with cystitis with apis to great success.
Wow.
Yeah, and I'm not sure if we go to that level. I'll check the emotions. There's a level of jealousy in there, as well, the emotional stuff that we often will look at behind it. And with this particular cat, it had it got a new cat. Obviously, a new cat had been brought into the house, and it was pissed off, literally. So, and no amount of it had 5 rounds of antibiotics and it's clearing it. So until we gave it apis remedy. And eye inflammation too. So, you know, allergies, and it can be an allergy remedy, where you get that red, swollen, again. And we can even use it in some of these fevers that sort of produce sort of swelling, and because it's got that heat in it.
So
Hives
for
is another
eyes,
one.
sorry, Tanya, for eyes like a sty, because a sty comes up quite hot and
Yep.
red and yeah.
Yep, absolutely. It's one of the sty remedies.
Great.
Yep. Yeah, and especially if it's tender and it doesn't want to be touched, or it wants to have cold on it
Yeah.
to relieve it. Hives as well they can be more swollen and red and shiny. And interestingly, it does have joint pains in it when you move. And it is, again, sometimes it's got that heat in it too. Yeah. And the sore throat sort of feels swollen, very, very sensitive to swallow. And they don't like hot food or anything like that. They don't want anything hot. Yeah, rheumatism, interestingly, people are, keep talking about these things good for rheumatism. So you'll find that any aches or pains after you've had a bee sting disappear. But they've come back, so it doesn't cure it. So there's that burning, stinging pains. The tongue can be fiery red. You can check the tongue if you want to use that as part of your thing. They're often very fidgety as well, and restless and irritable. There is jealousy in there. Oh, I don't know if I put that in there. They can be hard
It's under
to sleep.
emotions. Yeah.
Okay. Oh, good. Yes. And they don't want heat at all. So, if you find that even though it's a cold day, they don't want to be, they don't want to rug up or anything like that. Red, shiny, swollen, and sensitive to touch. They're basically the main symptoms. Anything, it doesn't matter what it is. If it feels red, shiny, and swollen, that's very sensitive, and you'll always look at apis. Yeah, and they don't really have a thirst for some reason. They can itch. That's usually the hives and things like that. Bites will start to itch more towards the end or as they're healing. Again, allergic reactions with food, with anything, you can definitely use this, although you obviously would take care and make sure you go to hospital or doctor if it starts to become difficulty breathing. I wouldn't risk that particularly. And this swelling, stinging, red, shiny, yeah. See, whereas belladonna has got sort of the red and the heat in it, it's not quite as shiny and as swollen. It's just got a red heat to it. To separate the two of them. In the urination is a big thing of apis. There's a lot of urination in it, frequency, but it does burn and sting. The eyes, which we went through before, fever. Yeah, the heat, but they feel chilly inside, even though their skin might be burning up. It's a bit odd, but they won't want heat. So some people, when they're chilly inside, want to be rugged up. They won't. See, they don't like a heat or stuffy room. They'll just want to be chilly. That's fine. Joint pain, yep, swelling. You know that, I don't know if you've ever had where your joints, it's almost like an injury, and the joints do get red, hot, and swollen. You can give them apis, an injury. It can work quite nicely.
And you'll
again,
get a few of these symptoms.
Yep.
There's quite a few in here that are the symptoms of COVID.
Yep, absolutely.
And, yeah, I was wondering, because when I had COVID, I had a lot of these symptoms, plus I had the cold and flu symptoms as well. But I had the sore throat with the, it was red and it was raw and it was dry and so many of these things. I'm going, oh yeah, my tongue was swollen and those sorts of things. So would you use this?
Absolutely.
If those symptoms were appearing?
Yep, it can be a flu remedy or, yeah, absolutely, a cold remedy. We'll often use it as a sore throat remedy.
Yep. Yeah. Okay, cool.
Absolutely. It's all those symptoms match. And we're looking again for that three-legged stool as we, on the original Saturday, which started off this lot of remedies course, that three-legged stool, we're looking for a minimum of 3 symptoms. And if you can tick off 3 symptoms on the same remedy, then you've got a pretty good match.
Yeah.
Tania, I have a question. What's the difference between fever and the hives?
Fever and hives. Fever is our temperature, whereas hives is an eruptions on the skin. Hives is a skin eruption or itchiness or a redness and a swelling on the skin. Fever is our internal body temperature, like a sweat or a chill.
Yeah.
That makes sense?
Yeah, but that hive not necessarily caused by food allergy, or could be food allergy.
Could be, yeah. But doesn't have to be, no. It could be a hives from nervousness or jealousy or, yeah, come out in other ways. Okay, any other questions with apis? So arsenicum, arselb or arsenicum is what it is, good old arsenic. So in arsenic poisoning, this is what happens. This is where we call the proving, where you take too much of the remedy or you give the remedy to a healthy person. And this is what the symptoms it produces is then what it fixes in an unhealthy person, or we're matching those symptoms. So there's a lot of burning pains, can be violent and they're burning. There is always an anxiousness to ourselves and a restlessness. They are very anxious and they keep moving around. They can't find a spot. They just don't know what to do with themselves. Vomiting and diarrhea, it's a big picture for ourselves, and they want water, but they just want little sips of it and quite frequently. So they're the sort of the top things you're looking at when you're looking at arsenicum album. We use it for colds, COVID, diarrhea, food poisonings, headache, insomnia, any sort of vomiting or nausea. Fevers as well. These are fevers with a chill though. So we'll come into that in a second. So it's made from arsenic, obviously, and it's poison. It is a poison, but it's, you know, it is found in nature, really. Yeah, externally it burns and destroys tissue. So with colds, if the discharge, you know, from the nose burns the top lip or burns under around the nose very quickly, not from blowing your nose and using lots of tissue, but the actual discharge, that's a pretty big cell symptom. If the discharge causes burning, keep that in mind. And yeah, accumulation of arsenic in the digestive tract basically causes nausea, vomiting, diarrhea. Pretty horrible. So it's one of our food poisoning remedies. It's one of the first ones to think in gastro, where there's a lot of vomiting, purging, diarrhea symptoms. Yeah, and there's a paleness. So often they look very pale. And they will feel cold as well. Not only are they internally chilly, they do feel externally chilly. So some people feel hot, like the apis on the outside, but internally they feel chilly. They feel cold in both areas. And there is a level of weakness and exhaustion. They will talk about, they might be restless, but they're actually exhausted, which is an interesting combination. So they don't know what to do with themselves, but they're so tired. So in between their bouts of trying to work out what to do with themselves, they just collapse in a state. And then they're up and moving again, and then they collapse. They want hot drinks and they want warm. They're just better for warmth. They don't want cold at all. Even though the fresh air makes them feel better, but they want things to be warm. There is a fear in ourselves that they're going to die. There is a level of catastrophizing in ourselves as well. So dryness and thirsty. The pains are burning, they're restless, they can be irritable, but there's usually more anxiousness in it than irritability, fearful, yeah, despair. Anxiety, it's one of the top anxiety remedies. And it always seems to usually happen around midnight or afterwards. These symptoms will often come on. There's often times of day where these things, you know, suddenly the child or you or whatever are throwing up in the middle of the night, you know, the food poisoning suddenly hits, or the gastro suddenly hits, and it's always in the middle of the night. One of those. All right. So the things that we look at to treat it with are common cold, flu as well, diarrhea. It can be quite smelly diarrhea, usually from food poisoning though, or indiscretions in the diet, put it that way, you know, or things that, it can be one if people have got sort of low grade or whatever, dairy allergies and things like that. Sometimes that will aggravate it, and our cell will help. They do have a fever, but they usually have chills with the fever. Again, food poisoning is one of the top ones to look at. Headache as well. So the insomnia is usually more to do with this anxiety, restlessness, anxiety. They have to be in there. It has to tick those boxes for you to look there. And there is a level of exhaustion, but they can't sleep even though they're exhausted. That's also in there. And if the dreams are in there, they'll usually be around death, something like that. There's that death focus. This remedy actually can also be used, which I have used with animals, to help them when they are dying, to help them adjust to that fear around the dying process. That's how strong the death stuff is in this particular remedy.
Okay.
Vomiting, yeah, obviously food poisoning. There is a lot of nausea and vomiting in it. Any other questions?
I did have a question, but now that page is gone, I
I'll
can't
come
remember
back.
what it was.
I'll come back to it. There we go.
That's all right.
Oh, they
yeah.
can be very fussy as well.
I know you would have mentioned this before, but but the greater than, lesser than symbols.
Oh, yes.
Does that mean it's made, the greater than, it is improved better by, or it's worsened by fresh air or cold air? I'm just
better,
not sure.
Greater than is better.
It's better. It's made better by those
air.
following things. Okay.
Yes.
That's what.
Whereas the less than is it's made worse from. So it's less for, as in it's less than.
Got it. Yeah. Thank you.
Makes it less. Yeah.
Yeah.
Yeah. Sorry. Yes, I did mean to cover that. Thank you. Okay.
Tania, I have a question. I realized personally for hay fever, I really like that remedy.
Yep,
And I
that's true.
wonder why.
Because now you know why. The
It
burning
means
eyes.
fear of death, or
Say that again.
oh no, I'll just say is it because of fear of death?
Fear of death.
Not because you had burning eyes or burning nose or sneezing. None of those symptoms.
No, I just always like itchy nose.
Mm-hmm.
So I don't really have I do have a swollen eyes, but occasionally, but normally is itchy nose.
Yep, it absolutely is one of the hay fever remedies. So, but that goes in with the cold, like anything that really can help with colds will also help with hay fever. They've got very similar symptoms. So always keep that in the back of your mind. You know, and in a way, they're both inflammation. So the body's trying to correct itself with an inflammatory response. So you're looking at which ways it's talking to us. Okay. And burning is usually, burning has to be there, whether it be burning in the nose or burning in the eyes. It usually has to be some sort of burning sensation for the arsenic melt to be really good, to hit it properly. All right, so Bryonia. Bryonia. This is another one that we used for flu and for COVID, interestingly. Inflammation, we often use it for breaks and bones as well. Basically, they're worse for any motion. They do not want to be moved, jarred, anything. Very sensitive to movement. Better for rest and for firm pressure. They can be irritable, from change of weather, and they do want large quantities of water. So this inflammation of those serous and synovial membranes, so, when they're inflamed, they don't want to be moved, or they're that rubbing and that scraping sensation. They just don't like that at all. It's for a cough, for a dry cough, painful cough, like a cough that really hurts. They don't want to move because they're frightened that when they cough, when they move, it'll hurt. Also has constipation. There's a lot of, again, dryness in here. So that can cause constipation. They do have fevers, and it's very headachy, very good for headaches, this particular remedy. And often it's around work-related things, overwork or worries about work, often related to work. And rheumatism, again, it has that inflammation and not wanting to move because the joints are sore. Yeah, poisonous vine, quite a big vine. Yeah, it's made from the roots. Inflammation, again. So rib breaks, anything where, or a feeling like they can't breathe properly, it hurts their ribs to breathe. That's a very good sign of Bryonia. Lungs, it's a bit painful to breathe. So any movement, they just don't want to move at all. They're too frightened to move because of the pain. They don't want to be disturbed again. Even their emotions don't want to be moved. They don't want to be disturbed. And they do tend to develop slowly. It's not a quick remedy. All right, change of weather. I'm just going to pause this.
On the handout, you've got modalities. What do you mean by modalities? No, the handout
Modality.
with the things on. It's got, you know, things
Oh,
like...
modalities means better or worse for. That's what modalities mean. I'm going to just resume. Oh, there we go. There's my resume. We'll get it. Okay. Yes, change of weather. So coming into spring, it can be a spring cold remedy as well. So this time of year, the weather starts to heat up. You could look at it if people get sick this time of year. There is always a dryness to Bryonia. If there's any dryness, you would always be looking at Bryonia. The lips, the mouth, skin, everything. This is another 9 p.m. one. We were talking about chamomilla. So, you know, sometimes, but then you have to differentiate the symptoms. The time might be the same, but this is where we come in with the different symptoms. Again, better lying still, and they also like the cold. They're relieved by cold. And thirst, they often have a large thirst. Not sips of water like the ourselves, they want big gulps of water. So, all right, the cough is again dry, won't be loose or wet, it'll be dry. Dry, hard, painful, often in the chest. They'll often hold their sternum or hold the chest because they feel pain. And which is why the better for pressure. They'll hold it, it makes them feel better. Again, also the bowels, the stool can be very hard and difficult to pass. Headaches, yeah, usually behind the eyeballs. And the headache will often come with the cough. So again, you've got this red, shiny, hot, swollen joints, but you really have to, you find that it is aggravated by the slightest movement, whereas apis isn't quite like that. But you'll also have this other dryness to it. It won't feel, apis feels a bit more, the level of swelling to it is more of a moist swelling. I don't know how else to describe that. It's not as dry, it's not a dry sensation. All right, Bryonia, ready for Rhus tox?
Yep.
So these are similar, and the reason I think we're going through these is to show you that similar of these aches and pains. These are often used for, this is another one we'll often use for stiffness in joints. So we're just sort of showing you the differences. So this is often one of the main areas that this helps is the musculoskeletal system. Lameness, stiffness, it's worst on first motion, but it gets better as you keep moving. So, you know, when you initially stand or initially they move, it hurts, but once they get it going, it's better. It's like, you know, oiling the oil starts going and you can start moving again. And Rhus tox also has this restlessness, a little bit like the ourselves, but it's got a level of restlessness in it. We do use it for coughs, fevers, influenza. It is a big influenza one where there's a lot of joint pain. And we also will use it for strains and sprains, and it is also skin eruption. So we'll use it for another one for hives. And just interestingly, the joint pain is quite stiff, and yeah, it can be used after a little bit like arnica exertion, but it's got much more of a stiffness to it, whereas arnica is it's like a bruised pain, whereas Rhus tox is more of a joint pain and a stiff pain, or ligament joint pain, slightly different. Talk about having to be put on the spot. To give you a little story to go with Rhus tox. On the weekend, my not only did I have a bee sting, anyway, I've got this very puffy face and my daughter brings home his girlfriend. They stay for the weekend. I'm feeling very sorry for myself. I'm not really interested. She's injured herself at uni, and so she must have been in some pain, and Aidan sent her out to me to say, Mum will ask Mum, she'll give you something for it, So I'm trying to think anyway, and she had this, it was an injury, but it was an older injury, like in 4 or 5 days old, and she had this stiffness in her hands, and she couldn't. I kept asking her, is it in the muscles or in the joints? What's happening here? Anyway, so she's never used homeopathy before, family of doctors and what have you, but she was open to me. So I gave her some Rhus tox and I sent her home. They left. So I didn't hear anything about it. Of course, in my thinking, oh my God, I've either helped or I've made her worse, or, like you go through all that stuff, especially when you're like, oh. Anyway, the next day I got a text. Oh, she was amazed. It worked so well.
Score. Good on you. Show those doctors a thing or two.
Yeah. She says, do you need a prescription for that? No, you don't. They don't scientific. He said, no, scientific community don't believe in it. She's like, wow, okay. So I thought, oh, score, that's nice.
Good on you.
So that's Rhus tox. I've used it for lots of different things over the years. Rhus tox, you may poison oak, poison ivy. I mean, we all know what symptoms that can create in terms of hives, again, itchy skin. So it is one that we'll often use for that very fine rash that can occur on people for some unknown reason, but it will usually be accompanied by some joint pain or ligament or lameness, or stiffness as well. And they need to move, which is what the opposite of Bryonia. So you know how Bryonia wants to stay very still, and they still might have that stiffness and that pain. Have I gone?
No, you're still there.
Okay. But Rhus tox still has the pain, but they want to keep moving, because of course more movement actually makes it better, whereas for Bryonia it doesn't do that. Okay, we start to see some differences, similarities but differences, and this is ways to differentiate between remedies. Yes, Rhus tox, from getting wet, change of weather, cold, wet. If they've gotten themselves suddenly wet or drenched, Rhus tox, they might come down with the flu, or then you would be looking at Rhus tox. Restlessness again, and that it does have burning pains in it too with Rhus tox. Again, they don't want to lie or sit for too long. Getting wet while perspiring is interesting. Sometimes, when blokes or people are out working hard outside and suddenly it rains and they get caught in it, that can definitely be a Rhus tox. It can come out, they need Rhus tox as a remedy. The cough, it's not usually a main cough remedy, but you'll see it in amongst all these other things. So it wouldn't be one I'd look at if just for a cough, simple cough. But if they've got a fever with achy aches and pains, then yes, I would definitely be looking at it. And they do seem to have this red triangular tip on the tip of their tongue, which is quite a distinctive feature for Rhus tox. You might see that, you might not. If you get that, bonus. And there is, Rhus tox is a good flu remedy, yeah, with the exhaustion, aching bones, joints, limbs. And again, this strain, so if, you know how we use Arnica for bruising and a swelling sensation, this is that stiffness, joint pain can happen. You know, people have overdone it, but their joints are telling them, not necessarily their muscles. Okay, it is a herpes or a cold sore remedy. Absolutely, we use it for cold sores, skin eruptions, which are itchy, and they usually have a vesicular, which means fluid-filled look to them, almost a herpetic look. And they are very itchy. It's an itchy remedy. So sometimes the cold sores and all that will be itchy as well. We come to the end of all our remedies. Oh, we're kidding. Okay, so how to choose a remedy. This is what you were asking before, Kay, in terms of modalities. So when we're looking at things, we sort of have to start to get in our head things to look for and things to note down and questions to ask ourselves or to ask them. What's the condition or even the complaint? Is it a sore throat? Is it a headache? Is it a achy pains due to a flu? Like, what is it we're looking at here? Where is the main location of it? Head, torso, back, you know, limbs. Causation, etiology, that is a fancy name for causation, which is really just what was the cause here? Was it going out and getting wet? Was it because it's an injury? Was it because we're exposed to someone who was sick? Was it because we ate bad food? You know, what's the cause? We have to look at these things. And then what's the symptoms? We start recording the symptoms. What are they showing signs of? Which we'll go through more in a minute. Concomitants. Now, this is another level. You don't have to worry about it, but I'm introducing it to you. So this has no relationship to what's going on, but for some reason it's happening at the same time. So, you know, they've got all these things, but their big toe hurts or something. Like, it's not even related. They only got a sore throat. In fact, actually, I had that on the weekend. So it can flare stuff where you've got separate things going on, but yet it's, for some reason, it's, you know, you didn't have it before, you've only got it while it's here. It doesn't seem related, yet somehow it is. So you can still take it as a symptom. We often call them PQRSs, peculiar, rare, queer, rare symptoms, basically. They can be concomitants. And the modalities are the better for or the worse for. You know, what makes them feel better, what makes them feel worse. And these are questions that no one really asks. We're not asked this. So then it's a new way of thinking. You know, you'll say to someone, oh, do you feel better if you put a cold face wash on? Like, I never even tried. You know, like, or do you feel better if you have a drink of water? I don't know. Yeah. So as you and get used to it too, you'll know the questions. And the time is always a good one if you can get a feeling for time. They're not all important, but you do need 3 things again to create that stable stool. That, you know, the 3 stool theory, so that you can find the closest match for your remedies. Temperature, have they got a temperature? Are they perspiring, or is it a dry temperature? And what's their thirst like? These are all good general things to look for. Okay. So, this doesn't show very well. So this is my table. Can you see that very well? Maybe if I make it. Oh, hang on.
Is that the answer?
No, this isn't. I'm just giving you this is an example. There's not an answer here. I'm going to end the show. There we go. I think you can see it better. The name of the person. So this is a sample how you might set up on a piece of paper when you're trying to work out the best remedy. Sometimes it's good to just do a little table on a piece of paper. The person's name, the main complaint, you've got to say they've got, this one's got headache. I'm giving you an example for Bryonia and Rhus top. So the symptoms are here on the left. Can you see those? You've got a
I
headache.
can't because I'm using my phone screen, so it's too small for me to read, but that's okay.
Okay.
I'll see it later.
We've got a headache. We've got doesn't want to be moved due to the pain. The joints are aching. They're very thirsty. They're better for rest. It's worse on the right side. So you go down and you've got Bryonia. You're tossing up between Bryonia and Rhus top. So you look in your book or you look at the lists of symptoms and you go, okay, they've both got a headache. I'm going to tick both those boxes. Doesn't want to move. Well, Bryonia's only got that. Rhus top doesn't, so you wouldn't tick that, but you can tick Bryonia, yeah? The joints are aching. Rhus tops is more like that. They're very thirsty. Bryonia's got more of that. And they're better for rest, which is Bryonia again. So, and they're also work on the right side. So you've got 5 that relate to Bryonia, only a couple that relate to Rhus top. So you're more likely to give Bryonia first.
That's good. That's a
Does
good
that
one.
make sense?
Mm.
It's just a way to try and get it clear in your own head. I mean, you could put, if you're confused, if you've got 3 remedies there, you're thinking about, you can put a 3rd one in and go through and tick cross, tick cross. So that, I'll just make it a bit bigger.
What happened?
A minute. I've got into the wrong document.
Okay.
Let me just try again. Here we go. Okay. So, all right. So if I come into this one, am I in the right? Yes. Okay. Yeah. Okay. I'm now in the right one. Sorry. So now we're going to do a couple of cases. Try and get you a couple before we finish tonight. You've done really well, and we've caught up. I think we've covered them all. Are there any questions before we go into cases?
No.
Okay. All right. Can you read the case? I'm too high up for you. So the first one is John has the flu. His joints ache all the time, especially when he tries to walk. He tried to run, but he was in so much pain he had to go home. The only thing he wanted to do was lie around quietly and read. Got a thirst for cold water. His mouth and lips feel very dry. And the flu came on after problems at work. He was losing sleep about clients. So if we did our little
Table.
If that's an option. And we're looking at the remedies we have to choose from are Apis, Arcel, Rhus tops, Bryonia. Let's see, looking. Yeah.
Bryonia.
Yeah. And why is that? Give me the 3.
Worse for moving, better for rest, and
John.
thirsty
John.
and Dryness. Yeah.
Yep, they're the three. So each time we're trying to find three if we can. So yes, that dryness, that wanting to rest and not move, and also the achy joints.
Mm.
Okay, cool. So the second one, very woke, violently sink
That
after eating kebab.
that is
Arsenica?
arsenica.
Arsenicum.
Yeah.
Yeah, which bits stand out for you?
Drinking in small sips,
Mhm.
having the coming on violently and quickly, and that fear of death thing you said
Yep.
was very connected with that one. Yeah.
Yes, it is. And food poisoning, which is obviously what she's got, I would say.
Yes.
something
Yeah.
like it.
Gastro was one of the main ones for gastro, wasn't it?
Yeah, yeah, and food poisoning or something that
Mm.
just doesn't agree. I generally, I mean, we don't tend to generalize, but generally, if I see that, I'll pretty much come in with ourselves pretty quickly, unless there's some symptoms that are telling me otherwise. It's one of our first ones. Okay, so the third one. Sally was out in
Well,
the park.
Tanya was out in the park and was stung by a bear.
My backyard.
Apis.
Absolutely.
Yeah.
That's an easy
Mm.
one.
Yeah.
And Judy was in the garden, she twisted her ankle, sprained it, recommended rest. Even though she'd taken arnica, she still had stiffness and pain.
Rust.
Stiffness is, that's Rhus tox, isn't it?
Yeah.
Stiffness and joint pain with stiffness.
Worse for moving.
Yep.
Better once they're going.
Relieved by heat.
Yep.
packs, right. Mhm.
Yes, interesting. They do want heat
Mm.
in Rhus tox. Okay, ready? I'm going to do another one.
Tania, can I ask, there's aconites for vomiting and diarrhea too, isn't it? Why is, when would you use that instead of RSL?
Aconites not as strong in the vomiting and diarrhea from memory.
Okay.
Not that I know of.
All right. I wrote it down. Nice.
Yeah, look, it does have some of that in there. It'd have to be, it would have to be brought on by shock, and a high heat fever.
Yeah. Thanks.
And they're hot. Yeah, they're not chilly.
Pale and cold. Yeah.
Yeah. And they would, they have to have some aches or pains with that. Diarrhea would have to be, is more a secondary, it's another symptom to add to aconite. It's not the symptom to start with.
Not the main one. Yeah. Okay, thanks.
But it can come along with flu and stuff as well. You know, some people do get flus with vomiting and diarrhea. So Jeff is suffering with a cough, dry, hard. Again, least movement causes pain in the chest. He holds his chest to keep it from moving.
That's Bryonia, isn't it?
Dry mouth, dry lips. Yep, thirsty. Irritable again. Did we do that one? No, that is business.
No, we didn't.
Yeah.
You didn't.
It doesn't always have to be about business. I remember using Bryonia my very early days. My father came down from Queensland and we probably had only known each other or met each other a few years earlier, pretty sure. And my early days of using homeopathy, but he just kept talking about work. It just drove me nuts. So I gave him some Bryonia. It was the complaining. It wasn't the thing. It was just this, level of it. And so the next morning he said to me, "Oh, that was great stuff. What did you give me?" That's good. So, I only based it really on that symptom. But anyway, it's a pretty prominent one.
I was going to say, if it's serious enough.
But I never forgot that because, you know, knowing him now, I know it's not in his miasmatic family, which is interesting. So it wasn't working on that level. It was definitely an acute thing. All right, so Sarah has chicken pox. Spots covering her entire body. Itching is so intense.
That's going to be apis, isn't it?
No, Rhus tox.
Rhus tox.
Rhus tox has that intense itching.
Oh, yeah.
I don't know if I mentioned that actually. May not have made that as strong, but it has got a level of really intense itching.
Intense. It's not just itchy, it's the intense itch with heat.
Yeah, they just want to scratch.
Mm-hmm.
And they are, even though it's worse than scratching. But
that restless moving,
Yeah. And these blisters,
with the clear liquid,
Oh God, I've got a few stories. Well, with chickenpox, when my son had chickenpox, I think he was 3, wasn't very old. That was, well, not that I did any of that anyway, but it was before any of those vaccines were around. And I remember at the time sort of, again, fairly new with homeopathy, so I was a bit nervous. And of course, Mum used to put calamine lotion on us, so I went, well, that's what I did. Well, he screamed the house down. It stung him to bits. He hated it. So I couldn't do that. So I thought, well, I have to use the remedies. And Rhus tox worked to treat. It was really good. Calmed him down. It's like, oh, okay. So he responded really well. And like he ended up having very minute, very few spots ended up coming out. You know, sometimes they'll get lots. Well, because he started to show them, but they didn't progress. It was very good.
Oh, great.
Not that you, but see, even for hives or things like that, you know, might not get a diagnosis of chickenpox, but you can still get those things that look very similar, even though it's not exactly that virus. It still helps those sort of symptoms.
Tania, I have a question. Is the Rhus tox like kind of one of the signature symptoms is chickenpox? Or?
Yeah, it is. But, well, shingles, cold sores, chickenpox, those sort of family, it does have that level of, if you were putting disease names on there, we don't tend to work that way, though, remember.
Okay, that's my next question. So Rhus tox should be effective for shingles as well.
Yeah. Not all shingles, but definitely the ones that have these joint pains and maybe eruptions or itchiness that are really intense. And this restlessness again and the stiffness. All right, so Lisa has cystitis. Urging is frequent, involuntary, urge to go. Main feature is the pain is stinging and burning with localized swelling. Feels better in the cool air or cold bath for uncovering. Any ideas?
Apis.
Yeah. The last one, Joel has been sneezing all day, thin, watering, discharge, irritating and burning, feels chilly, better for heat, anxious, nervous, doesn't want to be left alone, needing, demanding and thirsty for sips of water.
Arsenic.
Yeah. Yep, because
it looks like me, like sneezing all day. And the discharge is irritating and burning, like you said.
Yeah.
And the thirst
Feels
is
chilly.
satisfied by frequent small sips of water.
Yeah.
Yeah.
And the anxiousness again is in there, so that's always a good sign for ourselves. I'm just going to stop the recording.
Wants to know.